Hello everyone, welcome to the Early On. My name is Denise Sparks and I'm a resource consultant from Lansdowne Children's Center. Today I'm going to talk to you about toileting facts beyond the basics. Toileting is the process of training your child to use the toilet for bowel or bladder use and is an important skill necessary for daily life. In order for your child to achieve this milestone, a clear toileting routine should be established so that you can help your child increase their independence. First, you must decide when to begin training, remembering that all children are different as to showing toileting readiness signs. Plan to start gradually only when and if your child shows signs of readiness. It depends on your child's physical, developmental, and behavioral milestones, not their age. One child might be ready to start training at 18 months of age, while another is not ready till 36 months of age or beyond. You may want to begin this process of training using a potty or skip this step and move right into having your child sit on the toilet. The potty can be taken and used anywhere and is easily accessible by your child, but it can be messy and unhygienic. The toilet can be flushed by your child and may be less messy than a potty. It may, though, require an adult to assist the child up and onto the toilet seat and may also require a toilet seat reducer ring to help your child feel safe and a stool on which to rest their feet. This can provide stability when pushing for a BM, for instance. Consider having your child sit on the potty at the initial stages, wearing their clothing with their feet on the floor before removing their pants. Sitting on the potty or toilet every 2 hours or so, starting first thing after waking up, before and after meals, after nap, and before bed helps establish a routine. This can move to sitting every 15 to 30 minutes as your child slowly gets used to the potty or the toilet. Once the potty is used fairly successfully, consider skipping diapers and use pull-ups or training pants instead. Remember though that when wearing a pull-up, the child may not feel wet. Bowel control is often easier than bladder control, and it takes longer to stay dry through the night than it does throughout the day. Do not plan to toilet train when other things are happening at home, such as birth of a new sibling, a move, a transition from a crib to a bed, or you are about to travel. Words you may want to consider using with your little one should be words that everyone involved in the training are comfortable using and hearing your child say. Avoiding negative words such as stinky or dirty, but remember that there is always a wide range of words used that mean the same thing. Words such as pee-pee, tinkle, wee, or urine may be used along with poo, poop, dump, feces, stool, or bowel movement, BM. Your child may hear others use unfamiliar words and need to know that they mean the same thing. Remember to use the right words in the right setting so as not to offend others. Is there a certain time of year to toilet train, you may wonder? In fact, there is no right time to train exactly, but again, remembering to focus on readiness signs, not the time of year. Summer sometimes is a good time of year to train as your child may be wearing less clothing, meaning getting to the toilet quicker is possible. It is important to toilet train your child because many kindergartens and even some preschools may have a policy that children must be trained to begin. It may impact your child seeing others who are trained, and your child could unfortunately be bullied or teased by their peers if they are not trained. Rewards that you may find helpful with toileting your child are stickers that you may want your child to choose, edibles such as gummy bears or Smarties, providing a stamp on the back of their hand, giving a small item from the dollar store, or simply giving verbal praise for trying. Remember though, that after a period of time, it will be time to slowly decrease rewards given so that they are not expected. Make a deal out of a success in the toilet, a big deal. Be sure the childcare is aware of you working on this at home, so they too can try the same procedure at the childcare center. After 3 to 5 minutes of sitting to try and have a BM, let your child get back up and try again later. Remember that if they sit too long, they may consider it as being a punishment. Your child needs to sit and relax to concentrate. However, placing the potty in front of the TV may not be such a great idea. They may be so engrossed in the TV show that they are watching that they forget about just why they are there and what they are supposed to be doing. These are some building blocks to toilet training, including your child. Being able to communicate the need to use the toilet, being aware of toilet routines and sequences such as washing their hands once they're done, having control of sphincter muscles, being able to sit upright on the toilet and of course not fall off, being capable of dressing, undressing, and all the steps it takes to do, such as pulling pants up and back down. Clothing that makes the process of getting to the toilet manageable include the use of sweatpants, leggings, pants with elastic waistbands, or easy to pull down stretch pants. Forget belts or buttons at this time, including use of overalls, as these may hinder the removal of clothing. Casual clothing, not costumes, one-piece play suits or princess dresses, also can make getting to the toilet more difficult for your child to do. Girls of 2 to 3 years of age often like to wear dresses, which works well with toilet training, along with wearing thick tights in the winter. When at home, skip the wearing of shoes that make sliding pants all the way down hard to do. Underwear should be not too tight or loose. If you are training in the summer, you may want to consider use of a potty set up in the backyard in the corner. Sometimes problems can occur because your child is unaware that they are even wet or have soiled underwear, notice but has difficulty communicating that they are wet or soiled, has difficulty making it to the toilet in time, has sensory issues like things like sounds of flushing, the hand dryer being activated, or smells in the bathroom, which then cause upset. Unable to sit still long enough to concentrate on what they are needing to do, and just not aware internally to read body signals of the need to use the toilet. For children older than 5, having a lack of control of the bladder and constantly being wet through the day, you might want to consider a visit to your family physician to discuss this further. What happens then if you wait it out hoping as your child ages that they will toilet train? A disruption to daily social events like being invited to a birthday party or being invited for sleepovers, once attending school and still not trained, may occur. Toileting accidents may lead to self-esteem concerns for your child. So discuss any concerns you may have with toileting with your family physician or pediatrician. Seeking professional support from an occupational therapist may be warranted. Books like Diapers Are Not Forever by Elizabeth Furtick help children learn to use the potty and why it is time to do so. So thank you for joining our Early On parent session today.
A resource consultant from the Early Integration Program is available to talk to you should you want more information, support, or to discuss any concerns or questions you may have. Please contact us by email at eip@lansdowncc.com or by phone at 519 753-3153. Ask reception if you can speak to a resource consultant.